విదేశాల్లో MBBS.
You into the Gomel State Medical University. Now I will give you some information about our country, our city, and of course about educational process in Gomel University. Belarus, country located into the Central Europe. It has 6 regions. Capital of the Belarus, Minsk. Here you can see a photo of main building of our university. Here's a Gomel located in southeast of Belarus, Gomel's region. Dear applicants or first-year students, we are glad to see you in Gomel State Medical University. Your specialty, general medicine, qualification physician. Duration of education, 6 years. Population of Belarus, about 10 million people. We've got 2 official languages, Russian and Belarusian. No, in usual life we usually use Russian language. Belarus is very safety country. What is one of the most important for parents? To be sure that everything will be all right. I understand you very well because I'm father too. So I can say for you that safety level in Belarus one of the highest in whole the world. Crime level very low. We had no any accidents, crime accidents with foreign students. Everything was all right all years. And you can be sure that everything will be good with your child in Gomel. It is important for parents, even more than for applicants, I know it. So I can promise for you that everything will be good. Gomel is the second largest city in Belarus, population near 500,000, located on the river Soch. What can I say about my city? It's a beautiful, it's very green, a lot of plants, trees in the city. Very good state transport. No any problems with transport. Buses, trolley buses, mini buses. In all regions of the Gomel, students can go very fast. Belarus had been involved into the training of foreign students since 1961, many years ago. So that's why we have already a good experience in education of foreign students. Globally recognized courses by all countries, World Health Organization, MCI, UNESCO, European Council. Our certificates are valid in all countries of the world. Our graduates already have job in different countries, in North America, in Europe, in Asia, in any country. Of course, if you know local language. Here you can see the head of our university, rector, Professor Anatoly Lizikov. We have government and international accreditation. All certificates that level of our education very high. The last accreditation was in this year. There are 5 departments or 5 faculty in our university. Of course, you are interested in Faculty of General Medicine for overseas students. First one, general medicine, it's for Belarusian students. General medicine for overseas students, it's for foreign students. In same courses, but in different language. For Belarusian students in Russian, for Indian and other foreign students in English. In our university, we have near 370 professors and lecturers. We have World Health Organization experts, professors, associate professors. And here I want to pay your attention on professor-students ratio in class, 1 to 10. Why it is important? When group is not big, not more than 10 students, we can pay individual attention on each student. I remember all my students. I know in which areas of medicine knowledge of student a little bit better, in which areas less, so that's why I can help in education for each students. It is very important when group is not big. Today you saw some video about educational process. In this group was only seven students. Of course, when group is not big, it's very good. It's better for educational practice, easier for the teacher and for the student. And if a student understand that when group is not big and we student can be asked in each class, it increase discipline. Student will prepare for each class. Our faculty was established in this year, 2000, 80 years ago. That is my chief dean of the Faculty of Foreign Students, Alexander Melnik. So now, how we care about our students? We begin to care about our students already in airport. Students pass to the Belarus so far, we understand it. It's first in their life, and we meet them in airport. From first step, just they still not leave the airport where very high security level, we already meet them, go together with them into the bus where already hostel staff, dean's office staff again meet them and help them in accommodation. All questions, every student can visit our dean office and ask dean, vice dean or inspector. We help our students in all questions. Accommodation, being in Belarus, registration, education, medical checkup, on all questions. Also, each group has curator, special supervising teacher from different department. This curator, he knows everything about this group, about student, about his parents' general information, about his education, and can help in different situation. It's individual for each group. In hostel present hostel mentor, 3 or 4 hostel mentors every day. They check every day, every hour, they check being of students in hostel. Rules of behavior, accommodation, being everything, and help for the students. And check, of course, something forbidden in hostel, forbidden conflicts, forbidden smoking, use alcohol, that is all forbidden. And they check to prevent any accidents, any conflicts. Now we've got near 700 students from 30 countries. For overseas students, we've got 2 mediums, Russian medium and English medium, because we also have students from Russia, Ukraine, Turkmenistan, Russian-speaking students. They study medicine in Russian. Indian students and our English-speaking students, of course, study only in English from the 1st till the 6th educational years. Here, I want to pay your attention on last sentence. English medium, parallel learning of the Russian language. All English-speaking students from the 1st year must visit classes in Russian language. Why? Because in our educational process we use real patients, Belarusian population with real diseases. From the third educational year, students begin to visit real patient, and they have to ask them about their complaints, their problems. So that's why students have to know minimal Russian language to ask the patients about their problems. For this, students have 2 years minimum. First educational year, second educational year, when students visit classes in Russian language. So that is important. Our educational process includes traditional methods, lectures, practical laboratory classes, and summer practical training. Period of training 6 years, 12 semesters. First semester begin in September and finish in January. Second semester begin in February and finish in June. After semester, students first have exam, and after holidays. And 1st September in Belarus, it's celebration, Knowledge Day. Educational process begin from the 2nd semester. Here you can see some photos of our graduates. They're happy already, they finished their education, and they have certificate. Some of our graduates have a degree of honor. Our graduates successfully pass qualification examination in their home countries and in our countries. We know a lot of our graduates, they already have job. They are doctors in countries of North America, Europe, India, Sri Lanka, and our countries. And some of them in Belarus too. Some about educational process. Now here you can see some photos of lecture room, classroom. In first 2 years, students study basic subjects like human anatomy, physiology, microbiology, biochemistry, and other classes. For example, here you can see classes of human anatomy. In education of human anatomy, we use in dissection room real cadavers, of course. First, students study structure of bones, muscles, and later inner organs. This section room can be visited by students in any time, of course excluding night. Also, it's open on Saturday, on Sunday. If student wants to visit it, please, no problem, he can do it. Next, from the third educational year, students begin to visit all clinical departments like internal diseases, neurological diseases, surgical diseases, and other departments located only in clinics only. Every teacher in clinical department also and practicing doctor. It's rule. It's always so. Because it's impossible to teach the student if you are not a doctor. I mean clinical subjects. And as I said already, our students, they have contact with real patients. Like here you can see in class on pediatrics, you see childs, they examine them. Or classes on internal diseases, same, real patients with real diseases. So that's why our graduates after education, he or she already has not bad clinical experience. She or he already saw a lot of patients with different diseases. That is very important in education. I know that it is possible not in all countries. In our country, we always use patients in educational process. For educational process, we use all clinics. In Gomel, present 18 clinics with general bed fund, more than 5,000 beds. In each clinic located 1 or 2 clinical, and sometimes and more if it is big clinic, clinical departments. For example, my classroom located directly into the therapeutics department. First, we discuss with the student theoretical questions. We have some practice in classroom. After this, we go to the therapeutics department because patient's room located right near the classroom. No, there's several meters from it, 10, 15 meters. We leave the classroom, we go to the patient's room and examine patients. It's very important in education to see real patients. Here you can see one of our main clinics, Republican Research Center for Radiation Medicine and Human Ecology. Gomel's region has general borders with Ukraine and Russia. And every year a lot of citizens from Ukraine and Russia visit this clinic to be examined, to be treated, because they know about high level of medicine in Belarus generally and in this center too. Next clinic, Gomel Regional Clinical Hospital. It has more than 1,000 beds for inpatients. Clinical Hospital Veterans of War, that is my clinic, my department where I'm in Department of Internal Diseases, where I am associate professor, located in this clinic. You can see it surrounded by trees. Generally, I said already, I can repeat again, in Gomel, very nice nature. River source, clean river. We've got a lot of beaches in this river. We swim in summer. So nature is very beautiful. Gomel Regional Cardiology Clinic. No, in other clinics here, just several examples. Generally 18 clinics in Gomel. Now about educational discipline. It's very pleasant to see parents, especially parents. I want to explain you very important information. In our educational process, Each student must visit 100% of classes and lectures. Only after this, the student can go to exam, to pass the exam. I repeat again, 100%. If you've got one missed class or lecture, you can't go to exam. Of course, possible situation when student, for example, was sick, of course. If student has missed classes or lectures, we student go to the dean office, write application, where the student writes what's the data, what's the topic, no, what's the class, and the reason. After this, we give for this student permission. You see, it's written in Russian transcription, допуск. It's a little document with sign with stamp, and with this допуск, student goes to the department in special time, and student has extra classes where he discuss a topic with teacher who is on duty today, because student should not lose any knowledge. It must be 100%. And to these extra classes, student must be ready, same like to the usual class. If it is valid reason, this допуск free of pay. If reason not valid, student has to pay. One missed hour, $2.50. For example, if class 3 hours, just multiply and $7.50. I want to say you about situation in previous year. Sorry, but it was sad situation. That students of first educational year, they had generally whole students more than 3,000 missed hours of classes and lectures. More than 3,000. Please, dear applicants and future students, remember that money that you pay, that is not your money, that is parents' money. We always say for the students, take care about parents' money. It's not easy to have it. So remember about it. Visit classes, visit lectures, and you will not have problems. Every year we got some students who are lazy, students who like to sleep too much, who don't like to visit classes and lectures. From the first day we are talking to them, you'll have problems. You have to visit classes and lectures because it is impossible to have a good education at home. No, it's a pity some of them don't believe us. I told to them, if you think that in the end of semester, in the end of educational year, you'll have a gift from us, so we'll say, let it be, we will not pay attention on these missed classes and lectures. That is not true. It will not be. And 1, 2, 3 students still don't believe. And in the end of educational year, these students, they have serious problems. They cannot go to exam. They can't continue because they have no exams. They can't continue education. And after this, only 2 ways. Or this student will say goodbye for us and will go back to home. Or this student, possible one re-education on same educational year. The students come back on previous educational year. But it is possible only once. If student continue to do it again, we'll say for him goodbye. Discipline in our university high. Remember about it if you want to have a good education. If beginning of the class 9 o'clock, I come into the classroom 9 o'clock, each student must be there. If students are late, it's no. If it is first happened, no, okay, possible different life situation. We will not pay attention at first. If students continue to be late, again and again and again and again, we student has to go to extra classes. And that is not valid reason this student has to pay. Remember about it. This permission dopusк is valid for 1 month. In which period the student must visit this extra class. Of course, possible situation if student was ill, for example, for 1 week, he's got a lot of hours, we extend for him dopusк for 2 months, for example. But if student already has dopusк, but he, because of valid reason, for example, he was sick, but he didn't visit, he had time, but he didn't visit extra classes, 1 month later, this dopusк is not valid already, and this student has to pay. Scales from 1 to 10. Scales or max. Minimum passing, it is 4. If student on exam has 2 or 3 or 1, these students will go to re-exam. No, I think you understand the situation. It's a general rules in all countries. What is forbidden? To copy something on exam, to use phones on the exam. Of course, we are talking about it for students. What is the most important? What we want to see in students? Knowledge, only knowledge, and of course discipline. If student visit all classes and lectures, if student study medicine, this student has no any problem, and this student has a good education. Also, in education, if student study medicine good, if he, in each class he's got high marks like 8, 9, 10, in the end, this student will have automatic, or like, if this student will not go to exam, he's got high mark without exam. If not all marks are good, of course, this student must go to exam. Want to pay attention on last sentence. Textbooks will open you less than a professor. It is impossible to have a good medical education at home. Maybe in some education it's possible, but in medical education not. In classrooms, in clinics, students must see patients, must see diseases, must see results of different tests, laboratory tests, instrumental tests, and others. And that is possible only in departments, only in clinical departments, only in classes, not at home. Sometimes students tell us, I'll repeat this topic at home, no problem. No, that is no problem. That is problem. Because in textbook, no, were present all theoretical information, but medical education consists of theory and practice, and both parts are very important. And maybe student can have a good theoretical knowledge at home, but practical knowledge only in classes. What else parents think about? No, about climate in Belarus. Climate in Belarus moderate. In summer, maximal temperature can be no highest, maybe 35. Usual temperature in summer 20-25. Right now, for example, in Gomel, near 20 degrees of Celsius. In winter, temperature can be less than 0. No, usually not less than 10, minus 10, I mean. Very rare minus 20, but usually winter is warm. Not like in India, of course not like in India, but you know, students have no problems. Just warm clothes, nothing more. And remember, please, parents, don't be afraid. It's cold only outside. In clinics, in classrooms, in hostels, it's warm, because we're boiling. You understand it? Because especially mothers usually afraid so much, give some very warm covers for students, and don't be afraid, everything. And if a student needs something like clothes, shoes, he can buy it in Belarus, no problem, we've got everything. What is maybe absent in Belarus, it's some spices. We've got different spices in our shops, but you know, Belarusian cuisine, it's not Indian. We use a little pack, it can be enough for us for 1 month. I already know your food. When Sarah Jaram says for me that is not spicy, I don't believe him more. Because when I try to taste it, it is fire in my oral cavity. I understand that is your national cuisine, so that's why usually we see that students of second, third, fourth and higher educational years, when they come back to Belarus from India, they've got bags and with kilograms of spice. And when we just come into the hostel, we already feel the smell of Indian. All things, everything present in Belarus, no problem. In any moment, everybody can buy it, so don't worry about it. How to travel to Belarus? Sarah Jaram will explain you better than me. He is a professional in this area. Here you can see photo of about hostel. In this hostel, only foreign students, English-speaking students live. Always 24 hours, 7 days present security. On first floor, always present watchmen. In another floors, I told you already about it, hostels mentors. They check students being in hostel all the time. 11 o'clock, hostel lock, closed. Every student must be in hostel before 11 o'clock. Of course, if anybody will be late, he can push the bell button. He will come in. But tomorrow we'll have in Dean office this information that this student was absent at night in hostel. And we will call him to come into the Dean office to discuss this situation because it is forbidden. It's rule. Hostel closed in 11 o'clock and open again 6 o'clock. In all regions and in this region, of course, of the Gomel police patrol, especially at night, every 1 hour, if you look into the window, police patrol present. Not because of the high crime level. I told you already, and maybe you saw already video today. Crime level very low in Belarus. We had any crime accidents with foreign students. But for best security level, police patrol present. That's why also you must always have with you your document, because maybe police will want to check. They see you are foreign and check the documents, you show them and no problem, you go. In hostel, here we also can say thanks for the Medico abroad and Rajaram, because they help for us to prepare rooms for Indian students to the best condition. With general information about education, all this information students will have in Dean office. School fees in 1 year now $4,250. Usually students pay twice, one half in October, second half in February. What is forbidden? Poor academic progress, non-attendance in classes, conflicts, smoking, and others. If anybody will do it, this student will have reprimand. 2 reprimands possible. No, it is not mandatory absolutely, but it is possible. Expulsion from the university. Remember about it. You have to follow the rules of behavior of being in medical university. With documents for students, student record book, where written all your marks in exams. Student card, where written who are you, with educational year, your photo. It must be always with you. When you go to the clinical departments, to the clinic, you must to have medical clothes, like white medical gown, and especially we pay attention on clean shoes, new shoes. When your student just come into the clinic, the student has to change his clothes, his shoes, and after this, the student is ready to the class. You can see our official website in internet. All information here present in Russian and in English language. Just write in Google, Yandex, I don't know what you use, Gomel State Medical University site, and you'll see it. But what to have when you go to Belarus, with documents and others, what to do, Sarah Jaram and Medico Abroad Company will explain you best of all. Some positive information. Our students participate in our social and cultural life very active, very active. You know, Belarus, many years ago, it was one of the republic of USSR. Already many years ago, when I remember it, when I was a pupil, when I was a student, Indian culture, Indian films, songs, dances were very popular, and before and now. So that's why our Indian students, they participate in different celebrations, and we always like to see songs, dancers, and all. We've got a celebration of Faculty Day, Day of Faculty of Department of Foreign Students, of National Cuisine. For example, here you can see Festival of National Cuisine. I remember when this festival, when I visited it, every student wanted to give me a piece of food. And when I tasted several of them, it was fire in my mouth. But Ambassador of India visited us not once. Last visit was this year. He talked to the rector, dean. Also, in our university, every year we've got scientific conference, and students also, so it's we have special conference for young scientists, for students. It is in spring, usually in March, in April. And some students, of course students who have good marks, good level of knowledge, they participate in science in our university. They did, they wrote articles, they did reports on conference, international conference, where we have students from different universities, from different countries. If student wants to do some scientific work, please welcome. But of course, if your general education is good. So I think I told you everything. I just want to repeat. Welcome to the Gomel State Medical University, but not for the rest, not for the holidays. Welcome to us if you want to have a good medical education, if you want to have good medical knowledge, and if you want to have a certificate that you are a doctor, certificate which is valid in all countries of the world.